بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. I will talk about the tinnitus. Tinnitus is a sensation of a noise in the ear or head in the absence of any relevant external signal. So noise in the ear or head in the absence of any external auditory stimulus is considered as a tinnitus. It is important to distinguish between subjective tinnitus and objective tinnitus. Subjective tinnitus, which only the patient can hear it, while the objective tinnitus, both the patient and the examiner can hear the tinnitus. Causes of tinnitus. Subjective tinnitus can be caused by either pathological causes like impacted wax, fluid in the middle ear, acute otitis media, chronic otitis media, Meniere's disease, presbyacusis, noise-induced hearing loss, idiopathic sudden sensory neural hearing loss, and acoustic neuroma. While the systemic causes of tinnitus are metabolic, like hypothyroidism, hyperthyroidism, obesity, hyperlipidemia, vitamin deficiency, example B12 deficiency, or neurological causes like head injury due to labyrinthine concussion, temporal bone fractures, whiplash injury, multiple sclerosis, post-meningitic, or CVA. Cardiovascular causes of tinnitus are hypertension, hypotension, anemia, cardiac arrhythmias, and arteriosclerosis. Pharmacological causes, especially the ototoxic drugs, psychogenic causes like anxiety and depression. While the causes of objective tinnitus either vascular due to arteriovenous shunt, as in congenital arteriovenous malformation, glomus tumors of the middle ear, or arterial bruit like carotid aneurysm, carotid stenosis, vascular loop pressing on the vestibulocochlear nerve and the internal auditory canal, high riding carotid artery, aberrant internal carotid artery, or persistent stapedial artery, and the venous hum due dehiscence, jugular bulb, high jugular bulb, or due to objective tinnitus due to patulous Oustiacan tube. Patulous Oustiacan tube means abnormal widening of the Oustiacan tube, especially after sudden loss of weight, or clicking sound, which are caused by palatal myoclonus, or idiopathic stapedial or tensor tympani contraction or myoclonus, or dental or clicking of the temporomandibular joint. In management of patient with tinnitus, we ask about the character of the tinnitus, which is very important. And remember that tinnitus can be caused by medication. So we should ask the patient about the drug history, especially ototoxic drugs. And then we do complete ENT examination of the ear, and examination of cranial nerves and CNS is very essential. And in objective tinnitus, we should auscultate the ear, the eye, and carotids for bruit. The investigations of tinnitus, we start with the pure tone audiometry to see the type and severity of the hearing loss, and we should do tinnitus matching, determine the intensity and the frequency of the tinnitus, and allow future planning of sound therapy in the form of masking of the tinnitus. And we should investigate the patient for anemia. We should do complete blood count, fasting blood sugar for diabetes, and thyroid function test to see the hyperthyroidism or hypothyroidism, and serum lipid profile to exclude hyperlipidemia. MRI and or CT scan should be undertaken in the following groups. This is not routine only when there is a history of pulsatile tinnitus, if the hearing loss unilateral or bilateral but asymmetrical hearing loss, when the tinnitus associated with vertigo or associated with neurological symptoms and or signs. The treatment of tinnitus. Tinnitus is a symptom and not a disease. So treatment by A, treatment of the underlying cause, or B, when there is no cause is found, the management should include, number 1, reassurance and psychotherapy. We should explain to the patient the cause of the tinnitus, the pathophysiology of the tinnitus, and we should reassure him that the tinnitus is only a sound and there is no sinister pathology behind this tinnitus. And many times the patient has to learn to live with the tinnitus. Number 2, sedation and tranquilizers. They may be needed in the initial stage till the patient has adjusted to tinnitus. Number 3, masking of tinnitus, either by A, hearing aids. When there is a hearing loss, the value of hearing aids is to improve the hearing and at the same time to mask the tinnitus. B, we can use tinnitus maskers. They can be used in patients who have no hearing loss. The tinnitus masker provides a symptom-free period for several hours due to the phenomenon of residual inhibition. Or C, we can use tinnitus instrument. Tinnitus instrument is the device which contains both the hearing aid plus tinnitus masker in the same device. Thank you very much and good luck.